Your joint cartilage is silently deteriorating right now. Leading medical universities worldwide report that after age 30, cartilage thickness decreases by an average of 1.2% annually. The most shocking fact is this process happens without any symptoms. Most people visit doctors only when their knees hurt or joints make noise, but by then, over 60% of their cartilage is already damaged. Large-scale cohort studies internationally verified that 85% of arthritis patients could have significantly delayed progression with proper nutritional management in the early stages. Why don't most doctors actively share this crucial information with patients? Once you discover the truth about these 3 joint supplements, you'll understand why. First hidden truth: UC2 Type 2 collagen. Did you know most collagen products on the market are Type 1 collagen? However, 90% of our joint cartilage consists of Type 2 collagen. World-class medical teams conducted large-scale clinical research, showing that groups taking 40 milligrams of UC2 Type 2 collagen daily for 120 days experienced an average 40% reduction in joint pain and 20% improvement in joint mobility. Even more remarkable, it was over twice as effective as the typical glucosamine-chondroitin combination. Why don't most people know this fact? The answer is cost. UC2 Type 2 collagen manufacturing costs are over 10 times higher than regular collagen. UC2 collagen works through a unique mechanism. Rather than simply supplying nutrients like regular collagen, it regulates the immune system to fundamentally block inflammatory reactions within joints. Prestigious international medical journals published research showing UC2 collagen induces immune tolerance in the body, suppressing cartilage destruction caused by autoimmune responses. This explains why existing joint supplements couldn't provide fundamental solutions. They only supplied nutrients without addressing the root cause of inflammation. When choosing UC2 collagen, you must verify it uses patented ingredients. The market contains many imitations with similar names, but their effectiveness differs dramatically. Second hidden truth: Boswellia extract. The impact of this component, extracted from Indian Boswellia trees on joint health, is truly revolutionary. Meta-analyses published by global medical research teams showed arthritis patients taking Boswellia extract for 12 weeks experienced an average 65% reduction in pain indices. This matches the effectiveness levels of conventional anti-inflammatory painkillers. However, Boswellia's real value lies in having virtually no side effects. Long-term use doesn't cause gastrointestinal disorders or liver toxicity. Expert groups recognized by the medical community explained that Boswellia's main component, boswellic acid, selectively inhibits 5-LOX enzymes, blocking the production of inflammatory substances called leukotrienes. This mechanism is crucial because, unlike conventional anti-inflammatory drugs that only inhibit COX enzymes causing gastrointestinal side effects, Boswellia blocks inflammation through different pathways. Clinical trials by world-leading research teams reported that groups taking Boswellia extract for 6 months showed no difference in gastrointestinal side effect rates compared to placebo groups. The most important factor when choosing Boswellia is OCBA content. OCBA is the most potent anti-inflammatory component among boswellic acids, requiring products containing at least 10%. The recommended daily dosage is approximately 10 milligrams per kilogram of body weight. Why don't doctors frequently recommend such an effective component? It's not yet classified as a pharmaceutical domestically, and most medical professionals haven't sufficiently familiarized themselves with natural extract information. Third hidden truth: the golden combination of MSM and vitamin C. MSM stands for methylsulfonomethane, a sulfur compound, essential for forming cartilage and connective tissues in our bodies. Joint research by International Sports Medicine authorities published findings that groups taking 3 grams of MSM daily for 12 weeks showed 33% reduced joint pain and 42% improved joint stiffness. However, MSM's real secret emerges when taken with vitamin C. Vitamin C acts as a cofactor for prolyl hydroxylase, an enzyme essential for collagen synthesis. MSM supplies sulfur needed for collagen production, while vitamin C assists the process of synthesizing this into actual collagen. The amazing fact is that simultaneous MSM and vitamin C intake produces effects over 3 times higher than taking them separately. Research published in prestigious international medical journals reported this combination increased collagen density within cartilage by 28%. Another advantage of MSM is its benefits for skin, hair, and nail health beyond joints. Large-scale clinical research by world-class medical professionals showed groups taking MSM for 12 weeks experienced 25% increased skin elasticity and 20% improved hair strength. When choosing MSM, select products with 99.9% or higher purity. High impurity levels can cause digestive issues or allergic reactions. The recommended dosage is 2 to 3 grams daily, with 500 to 1000 milligrams of vitamin C taken simultaneously. Fourth, hidden truth: timing and absorption rates. Most people miss a crucial fact: absorption rates vary significantly based on timing and methods. Meta-analyses published by global medical research teams revealed joint supplements show average 40% higher absorption rates when taken on empty stomachs. UC2 collagen proves most effective when taken on an empty stomach in the morning. This allows absorption in the small intestine without stomach acid interference, enabling immune regulation functions. Boswellia, being fat-soluble, increases absorption rates over twofold when taken with olive oil or nuts. MSM dissolves well in water, making adequate water intake during consumption important. Taking it within 30 minutes after exercise proves particularly effective for damaged cartilage tissue recovery. Another important point is spacing these components when taking them together. Optimal absorption rates are ensured by taking UC2 collagen on an empty stomach in the morning, Boswellia after lunch, and MSM with vitamin C after evening exercise. Hidden enemies of joint health. Even excellent joint supplement intake sometimes proves ineffective due to hidden factors disrupting joint health. The greatest enemy of joint health, revealed by internationally verified large-scale cohort studies, is chronic inflammation. While sugar and processed foods increasing body inflammation levels is well known, surprisingly, many overlook sleep deprivation. Clinical trials by world-leading researchers reported that continuous sleep under 6 hours daily increases joint inflammation indicators by an average 45%. Stress-induced increased cortisol secretion also accelerates cartilage destruction. Research published in prestigious international medical journals revealed people in chronic stress states have 2.3 times higher arthritis development risks than others. Smoking is another hidden enemy of joint health. Nicotine constricts blood vessels, blocking nutritional supply to joint tissues. Analyses by expert groups recognized by the medical community published findings that smokers' cartilage regeneration speeds average 60% slower than non-smokers. Real usage cases and precautions. 52-year-old Kim received early-stage knee arthritis diagnosis and surgery recommendations, but after 6 months of UC2 collagen and Boswellia intake, experienced 70% pain reduction, avoiding surgery. 46-year-old Park significantly improved shoulder joint range of motion through MSM and vitamin C combination, enabling tennis resumption. However, identical effects don't appear for everyone. Individual constitution and joint damage degrees can cause differences. Those with blood coagulation disorders or taking specific medications must consult specialists before consumption. Pregnant or breastfeeding women and those under 18 should avoid consumption for safety. Those with allergic constitutions should start with small amounts and gradually increase. Maximizing joint supplement effects. Supplements alone have limitations. Maximizing effects requires proper exercise and dietary management. Meta-analyses published by global medical research teams showed groups performing low-intensity Exercise 3 or more times weekly. While taking joint supplements achieved over twice better results than supplement-only groups. Swimming or silver yoga exercises. Placing minimal joint burden prove particularly effective. Exercise strengthens muscles around joints, reducing joint burden, and promotes joint fluid circulation, facilitating smooth nutrient supply. Dietary intake should actively include omega-3, rich blue fish, antioxidant-rich berries, and vitamin K-abundant green vegetables. Conversely, avoid trans-fat-heavy processed foods, high-sugar beverages, and excessive alcohol. Today's information should help your joint health management. Most importantly, start early. Joint cartilage is difficult to recover once damaged, but manageable through advanced care. Start today if you want healthy joints for an active senior life. If this video helped, please subscribe, like, and set notifications for more health information. We'll continue delivering only verified information for your healthy living.